All right. Hi, I'm James Spillane. I'm here in beautiful Kenai in the Kenai Peninsula, and I'm at the Denina Wellness Center. And we're going through and we're looking at the different Gpra measures. We've already done tobacco cessation, and now what we're going to do is we're going to take a look at FAS, fetal alcohol syndrome. All right. So let's just take a look at what Gpra is, searching the logic for. So if we were to come into here in the Gpra selected measures, we'd see Gpra female active clinical patients age 15 to 44. So they're looking at basically anybody who's of childbearing age. Patients screened for alcohol use, had an alcohol-related diagnosis or procedure, received alcohol-related patient education during the report period. So these are the things that are actually going to satisfy that Gpra measure. So let's go take a look at what that looks like in your wellness tab. So one of the easiest ways to do that is anyone that comes up and they're kind of due for this, we can quickly come into here and we can perform an alcohol screening, select, and then we can basically say the result based on whether you guys are doing a cage or whatnot. Positive, we'll say negative, and you can put a comment in here if need be. You could also do historicals here, so if you go to ask the patient or you know that they've had someone done elsewhere, you can go ahead and enter it historically. So a lot of times somebody might do this in a note per se, but that's not going to, doing something in a TIU in the note, in the progress note, is not necessarily going to suffice. So what we're going to want to do is come in here and enter it historically, that it was done on this date by Dr. So-and-so. So I'll go ahead and say there. So that's how you basically satisfy the quickest, easiest way to do an alcohol screening. The other way is you could actually annotate up here an education that is performed. So you can come up into here and you can actually search for these and then do an education on that. So I think that would be alcohol and other related. And you could basically do a literature, lifestyle adaptation, if you would like, or disease process. And I'm going to say spoke to the patient for 2 minutes, and there we go. So that's how you satisfy the FAS Gpra measure. Thanks.